Edmonton firefighters are seeing a major increase in overdose-related calls. This, according to the fire chief. Edmonton Mayor Andrew Knack says while the city continues to support these efforts, more has to be done.
I know that Edmonton Fire Rescue is not going to leave people behind, and that's the right thing to do.
The majority of times firefighters are called to an emergency is not a fire. Last week, Edmonton Fire Chief said the opioid crisis continues to dominate medical call volumes, calling for more funding to keep up with the demand.
And we responded to well over 10,000 overdose-related calls.
There were 54,000 medical calls in 2025. Of those, over 10,000 were overdose-related, where firefighters had to administer naloxone over 2,100 times. That's a 175% increase from 2024.
So many city services and different agencies are consumed by that and trying to, seek solutions.
Mayor Knack says these are calls that should go to EMS under provincial jurisdiction, adding the cost of firefighters taking on medical calls costs the city about $28 million a year.
It's a reminder of why there's so much work needed. I'm glad the province is building recovery beds. We need those beds. We need all of them built as soon as possible. We also need the post-recovery beds and the housing units available.
Where our government is feeling that they have this false comparison, it is harm reduction or treatment. And you can't do it that way. You need both.
Petra Schultz lost her child to accidental fentanyl overdose in 2014. She believes the province should reinvest in harm reduction, like supervised consumption sites.
Every fire truck and every ambulance that responds to a preventable, and I emphasize preventable, drug poisoning is an ambulance or a fire truck that can't help other people. It's in everyone's interest to keep people safe, keep them alive, keep them well.
In a statement to City News, the province says opioid-related deaths in Edmonton continue to be significantly higher than any other jurisdiction in Alberta. The province pointing to significant investments to increase access to addiction treatment services and supports through a variety of programs, but not pointing to any funding related to Edmonton Fire Rescue. Hiba Kamal-Choufi, City News, Edmonton.